Our next speaker is Dr. Gerry Brock. He's professor in the Department of Surgery at St. Joseph's Health Centre in London, Ontario. Dr. Brock is secretary of the Sexual Medicine Society of North America, and he has served as the chair of the Canadian Male Sexual Health Council. He's the author of over 150 publications, 25 book chapters, and has received 20 research awards from national and international research organizations. He also serves on the editorial boards of numerous scientific and medical publications. Brock.
Thanks very much. I'm going to just come out, if I could, because I am standing, but you may not see me behind the podium. So I think they deserve a round of applause, don't you? I think it's been a great couple of sessions. Now, you know, Stacey told us about some of the different energy excursions that you have when you're doing various exercises and things, but and you talked about sex, but maybe we can have one more t-shirt so we get this right. Do you know what part of the sex act actually requires the most amount of energy for a man? Anybody know? What part of the sexual act? Begging. Okay. Think about it, it's actually true. Okay, I'm going to be talking about just a couple of things tonight. I'm going to talk about about erectile dysfunction in the heart and the effects on cycling in terms of what cycling does for your sexual function. How many of you ride bikes or cyclists? Okay, good. So this is going to be very appropriate. There was a huge controversy a couple of years ago that said you shouldn't ride your bicycle if you want to be sexual, if you want to get erection. So I'll show you some of the data. I'm going to have a little test for you, though. This is the audience participation part of the evening. And what I'm going to show you is a video. And some of you might have seen this video before, and I would ask you if you've seen it before, don't ruin it or give the right answer to the neighbor sitting beside you, okay? The video is going to show you two teams, one dressed in a white outfit, one dressed in black outfit, okay? And what I want you to do, they're basketball teams, and I want you to look and concentrate on the team dressed in white. And what I want you to turn off the sound is, and I want you to just go ahead and, let me just see if I can get this off here. Can I get it off? Okay, so count the numbers of passes that the white team does to each other. If they bounce the ball, it doesn't count. You have to count the white players passing the ball to the white players. You don't have to worry about the black shirted players. Count the numbers of passes of the basketball on the white team back and forth as much as you can. Okay, and what we're going to do at the end, I'm going to ask you guys how many passes from a white player to a white player occurred. And we'll see how many get it right. Okay, so let me just see if we can... Whoops! That's why we need to have two of those, right? Did you put a second one on? We'll have to go back. Okay. So the answer is 15. How many of you got 15 correct? Okay, very few. How many saw 14 passes? Okay. Did anybody see anything else? 16. Did anybody notice the gorilla? Right? How many of you think there's a gorilla on that video? How many of you who say that have seen the video before? Right, okay. So there's actually a little gorilla that comes in. Watch this. And the point is that if you don't pay attention to the whole big picture, you could miss what's really going on. If you're concentrating on the fine details, you'll miss something that's important. So just watch on the corner of your screen here. You were concentrating on the passing of the basketball between the white players, and what comes in here is a man dressed in a gorilla uniform. He then stops in the middle of the screen, pounds his chest, and then walks away. Okay, so now tell me, for those people who had never seen this video before, and didn't see the gorilla, are you kind of amazed? You are, right? So if you're paying attention to real details, sometimes you lose the big picture. And the point of tonight is, and it's great that you're all out here, is that sometimes we're so focused on work, we're so focused on making an extra dollar, we're so focused on the kids getting into that high-performance hockey team, that we forget about our own health. We forget as men that it's important for us to do the things that will really let us be around when our kids get older and get married. And so we're going to concentrate on a couple of things that I think are really important take-home messages. One of them is that the penis is in fact a very good indicator for how good your blood system is. In other words, how well your plumbing system in your body works, your circulation system. Your penis is actually the most sensitive indicator that will actually let you figure out if you're healthy or not from a vascular or blood flow point of view. Okay? So I'm going to make the point that, in fact, your penis can be your best friend. Now, for many of you, you know that, right? Because you take good care of your best friend every day. But, in fact, your penis can actually be something that helps you get into trouble, prevents a problem from developing. So most of us think we're kind of like Superman, that we're indestructible, made of steel, but in fact, that's not the case. And very often it takes someone else to point out that there's a problem down there. And I think that if there is a problem, then, you need to look into it, because the point I'm making is, if you have erection problems, you probably have problems with how well your circulation is in other parts of your body. Now, that isn't entirely true. There's a lot of different reasons why men can have problems with erections. We call it erectile dysfunction. And it can be problems with your blood flow or problems with how the nerves signal it. It could be the hormones that Dr. Bev talked about. It can actually be injury, a trauma down there can also cause the problem. And it could be non-physical causes, stress and other issues as well. In fact, it is incredibly common. So if we looked at a group of men between 40 and 70, a little older than most of you, but certainly there are certainly men in the 40s and 50s and 60s and 70s in this room as well, you have roughly a 1 in 2 chance that you have some form of erection issue. And if we look at the causes of those men who have erection problems, you can see this pie diagram really shows us there's a whole bunch of different causes. And the one that probably is the most prevalent is this one right here. It's a blood flow issue. And of course, men with diabetes have blood flow issues and also have nerve problems. So Dr. Elliott did a wonderful job in explaining to us that really an erection is just simply getting enough blood transferred into your penis, getting it squeezed off so the erection stays as hard as you need it for as long as you need it. And that can be a real issue and a real problem for a lot of men. So men are risk takers. We jump off hillsides with bungee cords, we parachute, we do a whole bunch of things. But one of the things you don't want to take risks in is your life. So this man took a risk. He bought a balloon, he was blowing it up, and he got a bit of a surprise. So sometimes surprises aren't a good thing. Come on, that's pretty funny. There's a whole bunch of you. This is supposed to be the West Coast. You guys are so relaxed. You guys are supposed to have fun tonight. Okay, so if you're sitting in the room right now and you don't have an erection, I'm sure there are some of you that don't. I can see the guys in the front too. But for most of you in the back that don't have an erection, right now you have about 1 or 2 cc's of blood going to your penis per minute. Okay? My question to you is, how much blood do you think you need to get going into your penis when you're going to have a full erection? In other words, how many fold increase does that blood flow need to increase for you to get a good woody? What do you think? Give me a shot. Someone from the front room here. Front row. What do you think, guys? How many fold increase? So from baseline? 3 times. Okay. I'm going to give you a hint. Okay? So whoa, that's a good hint. That's the answer. You can see in Ontario, we're pretty easy in our scholastic school system, right? So the hint was supposed to be, I don't know what happened to that next slide, but the hint was supposed to be that if you're a trained athlete, the blood going to your heart through your coronary blood flow from rest to maximum exercise is about 5-fold. Okay? So if you're a really well-trained athlete, at rest, your heart is getting a certain amount of blood flow. When you're exercising completely, running up the hill as fast as you can, it increases 5-fold. The penis, on the other hand, actually increases by 60 to 100 times. Okay? And in fact, we're probably going to see the slide next, we think the reason why there's such a big difference is, in spite of the fact that every man in this room thinks that the blood vessels that feed his penis are the same size as the blood vessels that feed his heart, they're not. The blood vessels in your penis are relatively small compared to the blood vessel size in the heart or the blood vessels that feed your brain, the carotids in your neck. And because with small changes in the blood vessel size, smaller blood vessels will see a much greater change in blood flow. It's like when you're using a hose to water your lawn. If you squeeze the hose, the water comes out more quickly, but unfortunately the flow is less. So, I think there's my hint, actually. So, actually, when I did this presentation in South Africa, it actually worked out well. Maybe things got switched around on the plane. Okay, this is a really important slide. And it's sort of real data from a large study. And I know that it's Tuesday night and probably this isn't really your bag, so I'm just going to give you the executive summary of it. The study looked at a group of 2,500 men and followed them for 7 years. Every 3 months or so, they were actually evaluated. And what happened was, these men developed new onset of erectile dysfunction. They were part of a larger study involving 18,000 men, roughly, but the bottom line was this, that this is a group of men who sometime during the study developed erection problems and they didn't have it before. And the question was asked is, if they develop erection problems, are they then at greater risk to have a heart attack or a stroke? And the answer was shockingly yes. It was actually a study that was done to see if they could prevent prostate cancer, and this is actually the group of men in that study who got a sugar tablet, placebo. And what they found was, from the time zero, where they developed new onset of erectile dysfunction, until they end up with a cardiovascular event, this isn't just having risk factors for cardiovascular events. These are actually having a heart attack or stroke. It turned out to be 11% in the 5 years from the time they had new onset of erection problems. So if you're in this room and you say, you know what, I started having problems with my erections a year or so ago, then you probably should speak to your doctor, mention that to them, see if there's some other cause. But if it turns out that it is in fact poor blood flow that's the cause of your erection problems, you're in that group. You're at risk to have a cardiovascular event because your penis may be telling you that there's not getting enough blood, and the same way that your coronaries are not getting enough blood. So if you look at the risk factors for actually having erectile dysfunction, there's a whole bunch of them here, and I want you to focus on the ones that you can really change, because some things are hard and some things are easy. This guy choosing the employee, he has no problem deciding which employee he wants. I want you to look at this and actually tell us which is the thing that you can change. And so you can see here that looking at your sugar control, if you're a diabetic, actually is one of the things that significantly increases your risk of developing erection problems. Another thing that you want to control is your cholesterol. You can stop smoking. Some of the things are going to be harder for you to adjust. You can't change your age. You really are going to have a difficult time with your cardiovascular disease. But just like Dr. Elliott said, just like Dr. Bebb said, there are certain things you can do that you really need to look at. Okay, we're going to shift gears a little bit now and talk about cycling. And again, a lot of you are cyclists, and the concern years ago, 5-6 years ago, was if you cycled, you put yourself at risk for erectile dysfunction. Now, this is a bicycle, so it doesn't project very well here, but there's supposed to be barbed wire across it, and that was sort of the common thinking. And this is supposed to be a cyclist doing the Paris-Roubaix. I don't know if any of you who are cyclists are really avid cyclists, but Paris-Roubaix is a long cycle on cobblestone road, so it's very tough on the pelvis. So cyclists are a little bit of a unique breed. They like to share, they do communal things. They're having a little bit of a health break here, a la cycling. And in fact, I could show you the data. Those of you may not recognize, but I'm going to show you that there's lots of evidence that cycling actually causes erectile dysfunction. You can see here, nice young avid cyclist, and you can see he's not fully dressed, but he's flaccid, right? No erection. Look over here. This guy also, pretty small penis. So it looks like there's no erection happening there. In fact, there's 500,000 visits to the emergency room because of cycling accidents. And 25% of those traumatic episodes, in fact, are neurologic. Pelvic injuries, typically they're going over the top tube and they injure their pelvis, or they slip and they fall. And we used to think, in fact, and still do, that in some cases, very prolonged cycling on a small, narrow seat may actually impinge or push against the blood vessels and the nerves that provide circulation to the penis itself. So this was just one study, and we'll go through these pretty quickly, but basically it shows really 540-kilometer ride here. And in that case, about 2/3 of the candidates actually had significant symptoms. You can see 22% had related to their nerves or the nerve supply to their penis. 33 had some numbness or hypoesthesia. Without getting too personal, for those of you who do ride a bicycle or cycle, how many of you have had numbness of your penis at some point? I can tell you that I have. Yeah, it's very common. I think you're being shy because I think every cyclist who's been on a bicycle for more than an hour has probably experienced the numbness. And so the current strategy would be to use a gel seat, get off your seat and get into your pedals so that you get the sensation back. And that's an early warning sign for sure. This is another study that was done that looked at mountain biking versus road biking, and it showed very clearly that the more traumatic exposure of mountain biking puts you at greater risk for erection problems. Another assessment, and this was a meta-analysis that actually looked at a large number of studies, and what they found was 3 hours per day, 3 hours per week was not associated with erectile dysfunction. More than 3 hours of cycling per week could be, based on the type of cycle, the type of cycling you were doing. So if you are a recreational cyclist, it's unlikely you're putting yourself at risk. On the other hand, if you're a high-performance athlete doing training and taking cycling pretty seriously, more than 3 hours per week, you should think of the strategies to minimize injury to your pelvis. That would be look at a seat, make sure the seat is designed so there's no pressure points, use a gel seat, maybe have a cutout seat. There's some new designs and I'll share that with you in a minute. So the bottom line is really that we think that what happens is that the nerve is in fact getting squeezed between the hard seat and the pelvis, and especially in situations where you're going through compression, you can actually injure the pelvic floor. And you can see for those of you who aren't cyclists, what we're talking about is that all of the weight from the back end here is on a very, very narrow seat. And in fact, if you can look at where the pressure points are, they are exactly where the nerves, the dorsal nerves of the penis come out, and the branches of the pudendal nerve come out. As a result, designers have made these sorts of seats that actually go on the buttocks, and so each saddle here, each half of it, has a pressure-free zone where you'd expect. There's other seats that have large cutouts to them. There's some gel foam and large padded seats, but unfortunately competitive cyclists don't like those because they're not very aerodynamic. The truth is that there is really no good data that clearly says there's one best seat compared to another. So what do I recommend in terms of cycling? Well, this is what I recommend. You need to cycle with someone who actually is there to help stimulate the blood flow in your penis as a protective agent. So cycle with a partner, okay? I did want to share with you a little bit of science as well. Dr. Elliott talked about pills like Viagra, Cialis, and Levitra. And I wanted to let you know that these are drugs that work for erections, not really because there's something mysterious about them working on the penis. They are simply drugs that work on your vascular system. They improve blood flow. And as a result of their action on blood flow, they have a number of different target organs. They may very well be proven to help improve your cardiac function. And in fact, they are banned at the Olympic Games because they are performance enhancement drugs. Okay? Not because they're dangerous, but because they are, in fact, performance enhancing. There are drugs already approved for the medical condition called pulmonary hypertension because it works on how well the blood and the oxygen exchange in your lung if you take that class of drugs. In fact, I wanted to share with you this paper that we just published about a year ago now, and it was very interesting. This is a diabetic man who unfortunately saw a friend of mine who's a plastic surgeon to have his left index finger amputated. He's a diabetic, poorly controlled, and this is a poorly healing ischemic, meaning there's no blood flow to the end of his finger, ulcer that they had tried antibiotics and every sort of therapy for, and he saw the plastic surgeon to have his finger removed because it was non-healing. Well, he actually went on a course of a PDE5 inhibitor drug that we talked about. His was actually Cialis, and this is the same individual 6 weeks later. He didn't have an amputation, and in fact, the medication which improves blood flow improved it to the point where it actually healed. So this is a unique case. It's actually been published with similar things. So I just wanted to tell you that there are things out there. There's some really exciting new things that are coming out in terms of helping us as men, helping us improve our blood flow, helping us improve our sexual function. But here's some take-home messages for you. And they're very much the same as what Dr. Elliott said. I'm just going to reinforce her points. Be physically active. Reduce your risk factors. We talked about those risk factors. Sedentary lifestyle, overweight, inactivity, high cholesterol, smoking, stress, all of those common risk factors that I think you all are aware of. Work on communication and relationships. And go and see your doctor, because many men don't see their doctors before a problem develops. They only see them once a problem is there. There are lots of new advances that are coming out. So in terms of cycling, it's important to listen to your doctor. I think you can read it from there. It says, I told you to take the white pills, not the blue pills, because they're no longer aerodynamic, these guys. And the last bit I'll share with you is an elderly man is changing in the physician's office. The physician is outside with his wife discussing what's transpired, and he tells her, your husband is suffering from a very severe sexual disorder. If you don't do the following, he will surely die. Each morning, fix him a healthy breakfast. Be pleasant at all times. For lunch, make him a nutritious meal. For dinner, prepare an especially nice meal. No chores, no nagging, and yes, make love several times a week. See, that's the cardiovascular exercise part. Do this for the next year and he'll regain his health completely. Well, he gets stressed. We're walking out of the physician's office and he asks her, what did the doctor say to you? And she says, the doctor says you're going to die. Thank you very much.